Another 97 people in China have been killed by the coronavirus. We know that over 44,000 people have been infected in China and the death toll has passed 1,100. Here's the Director General of the World Health Organization.
The number of newly confirmed cases reported from China has stabilized over the past week. But that must be interpreted with extreme caution. This outbreak could still go in any direction.
Well, outside of China, 25 other countries, all marked in red here, have confirmed cases, and there have been 2 confirmed deaths. You'll notice, though, no cases in South America, no cases in Africa. It's also worth noting that the daily rate of infection is falling by almost 50% since last week. On that issue, here's the BBC's Stephen McDonnell in Beijing.
We don't want to get ahead of ourselves because, I mean, if people became complacent, all of a sudden it could take off again. But for the moment, at least there is some sort of a suggestion that we might be turning the road. But until we're seeing, for example, tens of thousands of people in the recovered column, well, then people will start to feel a bit better then.
Development, the Mobile World Congress event in Barcelona, a vast industry event, has been cancelled because of the coronavirus. Also, the Chinese Grand Prix, which was due to take place in Shanghai in April, well, that's been postponed. Formula One says the decision's been made to ensure the health and safety of drivers, staff and fans. Also, in Geneva, scientists have been gathering at the World Health Organization to discuss ways to combat this virus. Here's the analysis of one of them.
The measures that China has taken to really contain the outbreak might work, and so it might end up as an outbreak that, of course, unfortunately has killed over 1,000 people, but can still be controlled and contained. On the other hand, we don't know, it might have already spread outside to many countries, and so this may become still a global outbreak or even a pandemic.
I think he's the hero of China. So even me. So I'm so proud of him. He told people the truth at the end of December. And, and then he passed away. I think in the second day, and in Wuhan and some other cities, and they held a short morning memory and just raise the mobile phone, turn on the light, and show this for a couple minutes, and then go back to work. They're not thinking about the death, and they admire him, and they suppose Dr. Li is a hero, including me. This is Chinese doctor. I suppose majority of Chinese doctor actually like him.
For about 2 weeks now, and many countries have closed their border off to us for fear of the coronavirus. The unknown is definitely something that evokes fear. We're all a bunch of human beings on this ship that have lives outside of this cruise ship that need us. We are hoping that just any country will see us as many human beings from many countries around the world that literally are at your mercy.
It's American Angela Jones stranded at sea on board the MS Westerdam, a ship with no home for almost 2 weeks because of coronavirus fears. Welcome to Full Circle. I'm Anderson Cooper. Her cruise left Hong Kong February 1st. It was then denied entry by Thailand, Japan, Taiwan, Guam, and the Philippines over fears of the virus. But out of the more than 2,000 people who are on board that ship, there are actually no cases known or suspected of coronavirus, nor have there ever been, according to the ship's company. This is all happening while global infections and deaths from the outbreak continue to rise. The death toll from the virus now more than 1,100 worldwide, more than 45,000 people who are infected in at least 25 countries. Now, I should point out that the vast majority of which are in mainland China, which does not include Hong Kong. Now, the message from the director of the WHO today urging restraint, quote, "The outbreaks can bring out the best and worst in people," and quote, "This is a time for solidarity, not stigma." Well, the passengers on the MS Westerdam have been experiencing that stigma firsthand for almost their entire time at sea. Today, they got some welcome news. Joining me now is another American passenger stranded on board is Christina Kirby. Christina, thanks so much for being with us. I'm so sorry for what you've been going through. Can you just walk us through this from the beginning? When did you first know that something was wrong?
Hi, Anderson. When we were turned away from Manila, the first port we were supposed to go to, that was an indication, but we took it in stride. It's been a magical mystery tour ever since, but we're trying to go with the flow.
Well, yeah, magical mystery tour. You're putting a happy face on this strange situation. Just to be clear, I mean, the thing about this is there are no cases of coronavirus on board your ship. It's just the fear that these countries had of a cruise ship landing and people getting off.
Exactly. It's been unreal. And, you know, my friends and family were reading the media reports back home, and there's just so much fear out there. And so, you know, I wanted to do whatever I could to help dispel some of that fear and paint a picture of what life really looks like on board the Westerdam. So that's why I've been tweeting and trying to keep humor and perspective, really, to show the world that we're not a plague ship. I mean, my heart goes out to the people who are quarantined. It's a horrible situation for them. We're in a very different situation over here in the Westerdam. We're just looking for room at the inn.
Yeah, and
the number of coronavirus cases has sharply risen following changes in the way it's diagnosed. The World Health Organization is seeking clarity from China after 15,000 more infections were recorded on Wednesday. 254 more deaths have been confirmed. That's more than double the previous daily record. Almost all of them are in Hubei province. Almost 60,000 people in China are now known to be infected, and the number of those killed stands at more than 1,300. Also, officials in Vietnam have placed a town of 10,000 people under quarantine following 5 cases of virus infection there. Vietnam declared a public health emergency over the epidemic at the beginning of this month. And in Japan, a cruise ship, the Diamond Princess, remains quarantined in Yokohama after an outbreak of the virus on board. It's now thought 218 passengers and crew members are among those infected. Our correspondent, Rupert Wingfield-Hayes, is in the port.
So the number of infections on board the Diamond Princess behind me here in Yokohama has again jumped today. 44 new cases confirmed today. That followed 39 cases yesterday. And that brings the total number of infections from the ship to 218. And that means, as we know now, that this is now the single biggest outbreak of the COVID-19 virus anywhere outside mainland China. The Japanese government has made a small concession to the criticism that has been building of its the way that it's handling this outbreak. They've said that very elderly people over the age of 80 will be allowed to disembark if they have underlying health conditions or if they're in one of those inside cabins that don't have any outside windows or balconies. So expect to see that start happening maybe tonight or on Friday. But there are many questions that remain. First of all, obviously, are infections still taking place? Is the virus still circulating around the ship? No one really knows. And the other big question is, why still has the Japanese government not managed to test all of the passengers and crew on board?
The current outbreak of COVID-19 highlights why this is so critical. Our greatest fear remains the damage this coronavirus could do in a country like DRC. Even as the flames of one outbreak begin to die down, we're fighting another fire front. As of 6 a.m. Geneva time this morning, there are 44,730 cases of COVID-19 in China, with 1,114 deaths. Outside China, there are 441 cases from 24 countries and 1 death. The number of newly confirmed cases reported from China has stabilized over the past week. But that must be interpreted with extreme caution. This outbreak could still go in any direction. The number of countries reporting cases also has not changed since 4th February. Of the 48 new cases confirmed outside China yesterday, 40 were on board the Diamond Princess cruise ship, which is currently quarantined in Yokohama. We're in constant contact with the Japanese government, the International Maritime Organization, and the owner of the ship to protect the health of all passengers. Now we have 2 cruise ships that have experienced delayed port clearance or have been denied entry to ports, often without an evidence-based risk assessment. Together with the International Maritime Organization, we will issue a communique to all countries to respect the principle of free pratique for ships and the principle of proper care for all travelers in accordance with the international health regulation. We have established lines of communication with IMO, the Cruise Lines International Association, and the major cruise operators to ensure we have accurate information and can provide the right advice. WHO has published on how to handle public health events like this on ships, and we urge countries and companies to follow that guidance. I'm also pleased to announce that today Cambodia agreed to accept the Western Dam cruise ship, which has been stranded at sea for several days. Based on what we have been told, there are no suspected or confirmed cases of COVID-19 on board the Western Dam. The ship will arrive in Cambodia tomorrow morning. This afternoon, I spoke to Cambodia's Minister of Health to thank him for allowing the Western Dam to dock in his country, and I would like to use this opportunity to also appreciate the government, especially His Excellency the Prime Minister. This is an example of the international solidarity we have consistently been calling for. Outbreaks can bring out the best and the worst in people. Stigmatizing individuals or entire nations does nothing but harm the response. Instead of directing all our energy against the outbreak, the stigma diverts our attention and turns people against each other. I will say it again. This is a time for solidarity, not stigma.